Hi, I'm Kaylee Rivera. I'm the Program Manager for CCTSI Community Engagement and Research Corps. And today I'm just going to be talking to you a little bit about what we are doing in response to COVID-19 and get you up to speed on our resources and what our Community Research Liaisons and PACT Council members are up to during this time. First and foremost, just want to remind you and praise you because I'm sure you're all doing the proper hand washing and social distancing, but just to continue to keep that up, and it's going to help us continue to flatten this curve. Well, I wanted to first start with a really inspiring story. Our PACT Council chair, Comilla is an ER doctor, and she actually volunteered to leave our state, Colorado, and go serve those in New York who are really, being hit hard by this pandemic. And so she has taken a month of her time to go out and work there, which is extremely, extremely inspirational and admirable. And another thing that I wanted to kind of talk through is that we had a meeting with our community research liaisons who work all across the state of Colorado serving various communities. There is a lot of concern around short and long-term consequences of this pandemic for small businesses. And while there wasn't some, of course, immediate response that we can have and solution, there was a lot of brainstorming and talk of how to sort of help address this and where to point people for correct resources in terms of stimulus funding and things like that. There were quite a few people on the call who did want to give a shout out to the healthcare workers who really stood out in the street during the protests here in Denver. Not sure if you saw that, but it was caught by national news as well. So a really exciting thing that we learned about was there is a relief fund that is helping tribal colleges to supply internet connections as well as laptops to those students. So that was wonderful to hear. And we're also hearing how communities are getting creative. They're creating online groups, they're supporting one another, they're sharing resources, whether that means food or the supplies they have. People are really connecting and being there for one another. While this is, of course, having many negative consequences, we are seeing that communities are coming together. We haven't, of course, solved the issues, and there's going to be more hard times ahead, but it's sort of brought that sense of community back to many areas of the state and people working and supporting one another. Something to also be on the lookout for in the link below is a resource sheet that both CCTSI Community Engagement and SNOCAP have put together, and it's an Excel file that has two different tabs, so be sure to click on both depending on what type of resources you're looking for. One tab is focused a little bit more on medical providers, primary care practices, while the second tab is focused on community resources. So if you have resources that you want to be sure are getting shared, are out there, feel free to contact myself or my coworker, Mary Fisher. Please let us know if you have any thoughts or other ways that we can share this out, because we want it to be available to folks and hopefully provide relief to some. Something to think about attending on Wednesday, April 29th, over the lunch hour, 12 to 1. Our group is hosting a community engagement forum that is really focused on this topic of COVID-19 and community, and how do you support and stay connected and work with communities during this time. So we highly encourage all of you to join us. Lastly, we're concerned about you. We want to know your story. We want to know what you need. We want to be there for you in whatever capacity we can. So if you're seeing this and you have thoughts or needs or anything, contact us. You can find us on various social media platforms. You can go to our website. You can email us, and we would love to hear from you. So please tell us your story. Tell us what you're seeing out there, and how can we continue to spread the word and help folks find reliable and reputable resources. I'm going to go ahead and end it there, but I hope everyone is staying safe, staying healthy, and check out our other videos for some more in-depth resources on things like masks and maintaining your mental health. Bye, everyone.